One of the things we love to do for our KSAT Q&A is separate the fact from the fear that's out there. And that's why we are always happy to be joined on Thursdays by infectious disease doctor from the Long School of Medicine at UT Health San Antonio, Dr. Ruth Berggren. Doctor, thank you for joining us. Where are we vaccine-wise right now, and what are the developments that you're hearing about?
So a very important development came out yesterday, which is that the Centers for Disease Control, the CDC in Atlanta, published online a playbook for vaccination. And what this means, it's a 55-page document. It's available in the public domain if you want to go look it up. It is the CDC telling communities like ours how to get organized and what to expect to prepare for delivering the vaccine. And we think right now that there may be as many as 5 vaccines that are approved, and they will be from different companies, different brand names. Most of them are going to require 2 shots. So you don't just go get 1 injection. You get your first shot, and then you wait 3 to 4 weeks, and you go back for your second one. And you're going to have to make sure that you get the same kind that you got the first time. In other words, they're not mix and match. So there are some logistical issues. We're not just going to be able to get everybody in a line and drive through and expect people to get vaccinated and have it be over with. It's a little more complex than that. And also, the vaccination is expected to be taking place in 3 different phases. So because not all of the vaccine, we don't think, is going to be available at once. And so in the first phase, we'll be targeting and prioritizing those people that are highest risk for having a bad outcome, like older folks, and also people that are on the front lines, those that are taking care of the people with COVID. Those people will get the vaccine first. And then in the second phase, additional people will be immunized, and so on and so forth. But it's a big logistical hurdle, and one that we have to get ready for, and one that's going to require a lot of partnerships between our public and private sectors.
So there was a lot to follow when it comes to this potential vaccine. But the conversation around vaccines right now is really twofold, because we're not just talking about a COVID vaccine at this time of the year. We're talking about the flu vaccine as well. You have been reminding people now is the time to go get that vaccine. Given this pandemic, what would you say to someone who says, well, I don't normally get it, and usually I'm fine every year?
Yes, so this year is the most important time to be thinking about it, because influenza symptoms are just virtually indistinguishable from COVID-19 symptoms. And we're heading into the fall. Schools have opened. If you get sick, you're not going to know which one you have, and there might be a surge going on. You'll have to get tested. You're going to have to get tested one way or the other, and it just creates a lot of commotion. And you could get both. You could get both flu and COVID at the same time and get even sicker. So multiple reasons to get your flu shot. Get it done now. I had mine yesterday. Very proud of that. So I understand some people in the newsroom might have gotten their flu shot very recently.
Dr. Ruth, I did it today. I knew I was going to make you proud.
She gets a gold star. Yeah.
I get a gold star from Dr. Ruth.
Steve, you're lagging behind. Now get with the girls.
It's part of my life.
You'll get there.
I'll get there eventually. Yeah. So clearly what we're doing right now is working when you look at the numbers, the masking, the social distancing, the washing your hands. But there are still people who are very sick in our community. I mean, you've seen that up close.
Up close, people in their 20s. I saw people today ranging from early 20s to late 70s and in between. And it's heartbreaking to see somebody who had a lot of life ahead of them, and now they're desperately, desperately ill. So people should not imagine to themselves that the virus is gone or that it's become less dangerous. It's still here. People are still coming in. Thank goodness there's fewer of them. But if we let our guard down, we're just going to see this multiply. So hang in there. I know people are tired of hearing about it, but we have to hang in there. And a vaccine is definitely on its way, so it's not going to be forever.
I saw something that grabbed my attention. It's a picture of you with a quote from you and basically talking about how voting is good for your health. Explain that to me.
How could voting be good for your health in the middle of a pandemic? Well, it turns out that people have studied those who vote and compared them to those who don't. In a lot of the literature surrounds young adults, and it's actually been shown in the literature that people who are civically engaged, they engage in civic activities, including voting, actually have better social connections, stronger social networks, better mental health, are less likely to engage in risky behaviors later in life, and therefore they're doing all sorts of things that can actually help them live longer. So would you live longer if you voted in a pandemic? The answer is it could be true if you do it safely. And so safe voting is going to be a major area of focus that everybody's going to be hearing a lot about in the weeks to come from our community COVID-19 response coalition and from the county as well.
And there are a lot of health safety precautions that the Bexar County Elections Office has put in place. So things will look a little bit different when people go to vote this year. But you can go to our website right now. Anyone who wants to know what that's going to look like can check out all of the changes that are in place to keep everyone safe while we vote. Dr. Ruth Berggren, as always, thanks for being with us, and we'll see you again tonight at 10.
Thank you, Doctor. We'll be right back.